Hello everyone, welcome to this new video on Neet Super Speciality. As you all know, the Neet Super Speciality exam was held and result has been published. Today in this video, we are going to see the super speciality branches of the medical curriculum in the medicine part. So 3 super speciality exams, actually 4. So in the medicine is 1, medicine super speciality, surgery super speciality, pediatric super speciality and obstetric and gynecology super speciality. So these are the 4 super specialty exams conducted in India. Among these, the medicine super specialty exam is the most toughest. So what's the reason? First we'll see that. So because if you see to the general rankers in the Neet postgraduate examination, so among the rankers from 1 to 3000, all the students they take 3 branches, that is radiology, skin and BD and medicine, as I already discussed in the previous video. So these are the 3 branches that the people take, and among the 3000 rankers, almost 2000 plus rankers they take medicine. So once you are acquiring an exam of Neet super speciality for medicine, that means you are competing with the best of the best. So we are competing with the best 2000 rankers, general rankers of India. So because of that, the medicine super speciality is the most toughest among all this. Apart from that, surgery and pediatrics, these are also toughest also, but medicine is the most toughest. So in this video, we will be purely dealing with the medicine department super speciality. So many are confused what is medicine, what is cardiology, what is neurology. Most of the means like poor people and most of the somewhat educated and somewhat uneducated, they are also confused. So let me tell you. At first, you have to do MBBS, that is a curriculum around 5 years of MBBS, 1 year of intensive, that is 6 years. After that, you have to do general medicine for 3 years. So 9 years all total. After you do this 9 years, so 6 years of MBBS, 3 years of medicine postgraduate, you will be eligible for this Neet super speciality. So medicine and super speciality, these are different. Different in the sense, all the medicine people, they will be aspiring for super speciality. Without clearing medicine, you will not be eligible to acquire for this exam super speciality. So the branches in the super speciality are, or in the corporate setups are, that is cardiology, neurology, gastroenterology and hepatology. Then coming to the branch that is critical care medicine, nephrology, oncology, rheumatology, hematology and finally endocrinology, which I have given the rank 1 in this all 10 spectrum. So 9 plus 1 hepatology is like 10 parts of this super speciality examination. So once you got we have to first thing is you have to get a good rank to get into super speciality examination, because if you see there is a pyramid like this. So this is a pyramid. So the base of the pyramid is MBBS students. So after a huge number of MBBS students, every year 2 lakhs MBBS student give exam for Neet postgraduate. So if you come to Neet postgraduate, to become into medicine, you have to get a general rank of around 4000. So among these 2 lakhs, you have to get a rank in between 3000 to 4000 to get into medicine. So the pyramid is like this. So in the base, in the middle part of the pyramid, there is medicine PG. And among these, 4000 to 5000 medicine PG, the number of good seats, if you consider, it is just like 500 to like 1000. So it's like a pyramid. So the Neet super speciality is the peak of the pyramid, that is the end of all the medical science. So in this video, we will be discussing all the super speciality branches and how their scope is. So the branch number 1, that is the cardiology. So cardiologists, they are called the legends of the medicine. Once upon a time and also in the present era, these cardiologists, they are called the god of the medicine. So these cardiologists, they deal with number of diseases like hypertension, heart attack and many emergency arrhythmias, and they also do different interventions like electrophysiological study like putting a catheter and angiography. Point out to us, they do angiography, that is their bread and butter, angiography. Echocardiography, that is mostly the cardiac ultrasound, that most of the laymen tell that is a cardiac ultrasound, that is echocardiography. They do treadmill testing, they do Holter monitoring and they do also different valvular heart surgery via the femoral vein. So this branch, if I have got a good rank and you have passed from some of the good institute like AIIMS, JIPMER, PH Chandigarh and SU also, you have got a good scope in the future, because most of the patients at present are getting into heart attack because of the increased incidence of this alcoholic and the smokers. the heart attack patients have increased a lot. So this branch is the most saturated branch of the entire medicine and super specialty department. So that is the only demerit, because the number of cardiologists in India and also in Odisha and also in Bhubaneswar is very high. So if you are coming from a good institute, you have a good future, but if you are coming from a peripheral institute, you may have to struggle a bit at the initial days. Coming to the second department, and this is also the second saturated department next to cardiology, that is neurology. So neurology, it's called the king of all departments and the most evergreen department of the medical science. So this is the most prestigious branch, because if you go somewhere and you say I am a neurologist or he is a neurologist, that's the most prestigious branch among all the undergraduates and also the postgraduate. In our postgraduate days, we used to give the maximum respect to a neurologist, because they are like, you feel like they are the core of the medical science. So these doctors, they deal with stroke, headache, memory loss, epilepsy, sleep changes and NCS, that is nerve conduction study, and electromyography. So as you all know, the backache patients and tingling numbness patient, they are very high. The number of patients in this department are very high. But the demerit is, it is the second saturated department of the medical science, because of the increased number of neurospecialists, neurologists and also neurosurgeons, they also practice, and orthopedics also still their patients. So these departments do have a demerit in patient load. But if you go to periphery with a neurology branch, your patients are very high, and is also a very good branch, prestigious branch, and also money is very good in this department. Coming to the third saturated branch of the medical science, that is medical gastroenterology. These doctors, they deal with liver diseases like cirrhosis, non-alcoholic fatty liver disease, and also different viral hepatitis and different liver tests these doctors do. These doctors deal with from the mouth till the rectum, that is the GI tract, these doctors deal with. They also deal with pancreas and also gallbladder. These doctors also do different interventions like endoscopy and colonoscopy, ERCP, that is endoscopic retrograde cholangiopancreatography, that is one of the advanced technology in this present era, endoscopic ultrasound, and third space surgery. The only demerit is the learning curve of this department is very high. To become a good ERCP surgeon, you need to be at least 8 to 10 years a good hand with different ERCP procedures. So this is the third saturated branch in the medical science. So after doing this neurology, cardiology and gastroenterology, it will be a very tough time for you to survive in cities like Delhi, Mumbai, Chennai, Bhubaneswar, Bangalore and all the metro cities and the good cities of India. This branch have got a good saturation, and it is very tough at the initial hour to work in these cities. So with these degrees you can work in peripheral setup, but it will be very tough for you to work in the corporate setup in the good cities. Coming to the critical care medicine, these doctors do have a scarcity in India. These doctors, they deal with emergency cases and at the emergency department and also at the ICU. These doctors are considered the savior of the patients. These doctors, the only demerit is they have a very hectic life. These doctors actually save the lives of a emergency patient. These doctors give ventilators at the ICU and also at the outdoor and casualty. These doctors do ABGist interpretation, and different emergency management also is done by these critical care medicine doctors. Coming to the fifth department, that is the nephrologist. As you all know, the incidence of acute kidney injury, chronic kidney disease is a very increasing trend throughout the world and the India because of this type 2 diabetes mellitus. These doctors have a lots of scarcity in the metro cities, Delhi, Bombay, Mumbai, Bangalore, Bhubaneswar, everywhere. These doctors have a very huge scarcity. All the doctors at present need nephrologist because of the increasing number of AKI and the CKD. These doctors, they do kidney transplant after fellowship, they deal with AKI and CKD. Hemodialysis is the core of this department, and they do different diagnosis of the kidney and also they do kidney biopsies. So these doctors are really the scarcity throughout the India. Coming to the next department, that is medical oncologist. That is the sixth in number, that is sixth, not in sixth, that means it is one of the leading department. They diagnose and treat cancer. As you all know, globally there is a very huge rise of these cancer patients. These doctors do have a lot of scarcity in India and the metro cities, and also in peripheral metro cities like Bhubaneswar, Bangalore, etc. These doctors, they diagnose with PET scan and different advanced technology to diagnose a cancer. They give chemotherapy, radiotherapy, different biologicals, and even monoclonal antibodies, which are very costly. At present, there is a very huge scarcity of this oncologist. So if you come with an oncology degree, all the corporate setups, they are like wishing to take you, because there is a huge scarcity, as I already told you. Coming to the department, that is a rheumatology. Rheumatology is the most interesting branch of our medical science. These doctors deal with every organ of our body, starting from the brain till the lungs, till the heart, till the GI tract, till the bones, till the joints. Every organ of our body is dealt by this rheumatologist. These rheumatologists do have a lot of respect among all the medicine doctors. They mostly deal with rheumatoid arthritis, SLE, APLA, sarcoid, Sjogren, and different rheumatological conditions. These doctors, they do different costly tests like INF profile, RA factor, anti-CCP, and they give drugs which are very costly, and monoclonal antibodies and different biologicals are given by these doctors. Because of the increasing number of the rheumatological diseases and yearly diagnosis, and the knowledge the patients have, every patient in India now they are knowing that there is a rheumatology for our treatment. So the backache patients, etc., they mostly choose at present to go to the rheumatology outdoor. In our SCV Medical College, apart from medicine, rheumatology has the maximum number of outdoor and indoor patients in our Cuttack. So this branch is a stress-free branch, and the money is very high because of the biologicals and different monoclonal antibodies and investigations, and have a very secured future in the future. Coming to the hematology. This hematology I will give as a rank 2. The rank 3 was, I already told you, rheumatology. Hematology I will get a rank 2 as per me it is. It is a very high scope in the future because of the increasing number of anemia, sickle cell disease, thalassemia, thrombocytopenia, pancytopenia. Almost in my outdoor and in indoor, I get a huge number of this pancytopenia patients who are getting undiagnosed because of the lack of this hematologist. And these hematologists also deal with blood cancer, that is AML, CML, ALL, HL, Hodgkin lymphoma, non-Hodgkin lymphoma. So different hematological diseases these doctors deal with. So there is a utmost scarcity of these doctors. These doctors do flow cytometry and different tests which are very costly. Drugs, give drugs which are very costly, like chemotherapy drugs are obviously very costly. Monoclonal antibodies, and these doctors are very research oriented doctors, because there is a lot of research is going on these departments. So these doctors, there is a huge scarcity of the hematologists in Odisha as well as in India as well as in the world. So because there is a huge scarcity of doctor, after passing out from this branch, that is hematology, you will have a very secured future. Coming to the rank number 1 as per me, that is endocrinology. So endocrinology, many call it like skin of the medicine. Skin department in medicine is called what? Endocrinology. These endocrinology doctors, because of the increasing incidence of type 2 diabetes mellitus and thyroid disease in India, these doctors are the first rankers in our medical curriculum, because in every house at present you will find what? Diabetes mellitus, that is known to everyone. So everyone, they hanker for endocrinologist at present. So the number of patients in this department are extremely high. These doctors, they deal with, I already told you, diabetes mellitus, thyroid disease, infertility, and bone disease. These are the maximum demanding doctors at present, and they are considered the maximum earning department, or maybe the second earning department next to the hematology, I guess. And these doctors have a lot of scope in the future, and is a most secured branch at present. There are many corporate hospitals which even lack endocrinologists because of the increasing incidence with diabetes mellitus. These doctors, I will give it a rank 1. So let me remind you, I gave the rank number 1 to the endocrinology, rank number 2 in the Neet SS, I feel it is hematology, and the rank number 3 will be rheumatology, and the rank number 4 will be nephrology and critical care medicine. Then there will be 3 saturated branch, that is cardiology, neurology and gastroenterology. All these 10 branches including hepatology has a very good future if you are studying well and you are passed out from a reputed college like CMC Bellore or CBJ Lucknow or RML Delhi or GB Pant Delhi or IMS BHU etc. So you have a very good future. But there is saturation actually in these 3 departments, that is neurology, cardiology and gastroenterology. Rest branches may be saturated in like 7 to 8 years, but at present I will give endocrine as a rank 1, hematology as a rank 2, then rheumatology as a rank 3, then oncology as a rank 4. That's my ranking. So hope you enjoyed the video. I will be coming the next video with surgical super specialty department. So super specialty, let me tell you again, you have to do a 6 year of MBBS, 3 years of postgraduate, that is a total 9 years, and bond maybe in some colleges are very strict. So after 10 years you will be eligible for this exam, that is Neet super specialty. After Neet super specialty, the average salary of a doctor would be around, what I heard is 1.5 to 3 lakhs or maybe 4 lakhs or maybe 6 lakhs in some departments like endocrinology or hematology. But in the core department, that is neurology, gastroenterology and cardiology, it's around 1.5 to mostly 2 lakhs in the corporate setup, and that too if you are passed from a good institute. So hope you enjoyed the video. Next video will be on surgical super specialty and pediatric super specialty. Thank you so much. Hari Bol and Hare Krishna.